Smilow Cancer Hospital at Yale New Haven and Yale Cancer Center is revolutionizing cancer treatment. It's there where some of the nation's best minds are working to develop new methods to prevent, diagnose, and treat cancer. The hospital's first annual Closer to Free bike ride takes place September 10th. And here to tell us all about it is Abe Lopin. He is the Vice President and Executive Director. Dr. Tom Lynch is the Physician-in-Chief. Welcome. It's great to have you both here.
Thank you. Thanks for having us.
Great to be here.
It seems like to me that Smilow was just built, but how long has it been here now?
Well, we opened in October of 2009, so we're about 18 months, 19 months into Smilow. It's been absolutely fantastic.
Lots going on there. And with cancer breakthroughs, what can you tell us?
So we're working really hard at Smilow to bring the very best, newest therapies to our patients. We're working on creating multidisciplinary care, so you don't just see one specialty, but you see many of the specialties: surgery, radiation, medical oncology, bringing them to bear on cancer. And we're focused on research. We're focused on bringing new types of treatments that can change how we do against cancers. And then most importantly, we're trying to personalize care, because the care for Mrs. Johnson may not be the same care for Mrs. Jones.
That's right. And this is such a great service because this is really for residents here in Connecticut, and they don't have to travel so far. They used to have to go to Massachusetts or New York. Now everything is right here.
Absolutely, Jocelyn. In the last couple of years, we've seen a big shift in patients leaving the state of Connecticut for cancer care, staying home, closer to home. And we know cancer is best when it's treated closer to home. So we're very happy that that trend has begun.
Now, I would also add, we're finding many patients are coming from other states to come to Smilow.
And that's because of all the people you have actually gathered there, all the great minds.
We've been recruiting aggressively, and we have brought about 45 new scientists and doctors to Smilow over the first year of our active recruiting. We plan to bring another 45 to 50 new doctors and scientists in, and we want this to be one of the world's very best cancer hospitals.
You're doing so much for the community. Just last week I was there at Smilow, and I did a story on the head and neck cancer screening. To preview that, the following day was a free screening for the community. And Abe, you say that you actually found...
We had 250 individuals who went through the screening that day, and 15 of those we found something of suspicion, which now moves them to the next level. And those are 15 individuals, perhaps, that would have gone undetected. So we're thrilled that we were able to do that. We're thrilled that you helped us cover that story. And there are 15 individuals who now will get some care perhaps that they wouldn't have had.
That's right. Really quickly, early detection, key to cancer treatment.
Particularly in a head and neck cancer, where you can find lesions that are precancerous, and you can take them out without causing a lot of the morbidity. In head and neck cancer, if you do big operations, it can affect your ability to talk and your ability to chew.
All right, let's talk about something big that's coming up in September, the Closer to Free ride. How did this all come about?
So, as Dr. Lynch said, 2009 we opened Smilow Cancer Hospital, and we were looking for a venue, an event that would focus attention on not only Smilow Cancer Hospital, but the battle against cancer. And so we came up with this ride, which allows every age, every gender, every skill level to be able to participate. And so we came up with this ride, which is 100 miles, or for some of us, a 25-mile route, a beautiful
I'm with you
day.
there, 25
miles.
Yes,
exactly. So it gave us the opportunity to say, here we are, you can participate in any way. You can ride, you can volunteer, you can support someone who is riding. So it was an event that lots of people, no matter how you wanted to participate, can participate.
You have a lot of corporate sponsors, but really what you want are people to sign up and get involved and ride.
Right. I think that one of the things that Abe's saying is really important, which is cancer doesn't just affect one person. It affects a family. It affects a community. And people want a way to give back. And this Closer to Free ride is a way for people to participate in the care of their loved one, the care of their community. And it brings money to support research. It brings money to support cancer care. Many of the projects at Smilow will be supported by the Closer to Free ride. So it's incredibly important to what we're doing, and it's really a way for people to be involved.
Well, we all know somebody who's been affected by cancer. So I can understand what you're saying here. Exactly. Now, tell us more about the route itself.
So the route is, as we say, it's 100-mile or 25-mile for some of us, but it will go through more than 10 towns through Connecticut and really wind its way through some of the most beautiful Connecticut coastline. It will start out of the Yale Bowl. It'll finish at the Yale Bowl. We have stops all along the way with food and with assistance, whether mechanical assistance or medical assistance. So there's a route that's been planned that will help people through it. And at the end, we're going to have a big celebration when everyone comes in, whether 25 miles or 100 miles. When we're back at the Yale Bowl, we'll have a big celebration, not only for the riders, but their families, volunteers. So it's going to be a terrific day.
And you expect it to be pretty much an all-day affair?
You know, I mean, the 25-mile ride should take people only a couple hours.
Right.
But the 100-mile ride is a 6 to 8 to 10-hour event.
Exactly. Are you going to do the 100 miles?
I'm probably going to do the 25. My wife's doing the 100.
Okay.
So there'll be someone in the family doing the 100. And, you know, pretty much anyone can do the 25-mile. If you go to the gym, if you work out regularly, most people can do the 25-mile. And the 100 miles for the cycling enthusiasts. But I think they're both great ways to get involved.
All right.
On our website, rideclosertofree.org, there's information about training and how you can get involved.
That's right. You can get training if you're
Yes.
not as, I guess, as good of a rider as some other people are.
That's true. And that information is on our website.
Is on your website, and that number is also, there's also a number there for everybody to call right there on the screen, and the website again is rideclosertofree.org. And I don't know if everybody got to see this shirt that everybody gets to wear on that ride. And
that's correct.
John Pearson has already been wearing this because I know he's been promoting the ride. He's going to take part.
And Channel 8, a great sponsor, and we thank you for that.
Well, we are thrilled. Again, really quickly, the money stays here.
And I think that's really important, is that this helps support cancer care and research in Connecticut, in our region, and it affects our community. So it's a way of giving back that has incredible impact in our community.
All right, very good. Abe, Tom, thank you so much for being here.
Thank you,
Thank
Jocelyn.
you.